Um, yeah, I think that's all on my list. Oh, so I guess my last question for both of you, specifically when it comes to advocacy, and I always love talking with leaders about this as well. And Aaron, I'll go to you first. And when you talk to medical students and they tell you, Aaron, this advocacy stuff, this is really for you. This is for people like you, who really love it. Me, it's not really for me. I'm not really interested in it. Why should I, as a medical student, be an advocate for anybody? What would you tell them?
I would tell them that an attitude like that of apathy would get you nowhere. You can say, "Oh, you can't change anything, you can't affect anything," but I've heard from legislators time and time again how important it is just to hear people's voices. And if you just think of it as this disconnected process, and you're not engaged, you've got nothing going on. But if you take time to learn the issues and integrate yourself into the process, you can learn, and you can really advocate on behalf of people you care about. So I would encourage students to make your voices heard, because there's so many issues that will affect you, currently, not just down the road, like GME funding, loan repayment, the and stuff that affects patients, like whether or not to expand Medicaid. There's so many issues that voices are really important for, and it's these grassroots efforts of students and of physicians and residents who can counteract some of the influences in politics that aren't so good. So I would encourage students to hold on to that drive and just engage.
And Diana, the same question. And you were there once. You were like, "This is not really for me." But when you talk
Yeah.
to students at this meeting and they say, "Diana, this advocacy stuff, it's not really for me. I don't really think I can really make a difference, or I don't really think I'd be good at it." What are you going to tell them this week?
I mean, I would say that, like, I actually kind of disagree with Aaron when he says that attitude will get you nowhere. That attitude is actually what's gotten us into the state that things are in right now. And so we've sort of seen that by physicians not being as politically involved, things don't really work out for the health of the nation. And you don't realize that no one is going to advocate for your patients if you don't. You start to have that realization when you see the way that some things in the healthcare system are set up. And there are a lot of people who are sort of making rules about these things in the healthcare system, and they're not seeing the effects. And someone has to let them know. And if not you, then who? Really, who?
Touche, Diana, touche.
I'm not. Well, I'm not in your district, so I can't call up your congressperson and say, "Hey, I think you should change this." It means something, and that's what I found out at FNCC. It means something when your congressperson or a representative from your congressperson's office hears you speak about something that you have firsthand knowledge about. They don't have the firsthand knowledge that you have, and they're looking for it, and they're looking for those personal stories, because as I learned at FNCC, politics is less driven by hard facts and numbers and more driven by personal stories. And so if we can get our personal stories, which actually line up with the hard facts and numbers, we can be a really powerful force in family medicine. And that feeling that you get from telling your story and listening to, someone who represents, the legislative branch of, the U.S. government, looking at you and listening to you and nodding along, and you can see it resonating with them, then you found your voice. And I would challenge students to do that, because you don't know until you found that voice and how incredibly powerful it feels and how incredibly powerful it makes you.